Welcome to This Week in Otolaryngology. This week we're covering 10 notable papers spanning pediatric hearing and safety, new laryngology and rhinology interventions, and critical decision-making in head and neck oncology. Let's dive in. We begin this week with important updates in otology and pediatric hearing, looking at the timing of intervention, diagnostic screening, and the comparative efficacy of treatments for complex inner ear disorders. First, a multi-institutional retrospective cohort study in otology and neurotology evaluated spoken language outcomes in congenitally deaf children who underwent cochlear implantation. Led by Patel and colleagues, this study analyzed data from 2017 to 2025 across 9 cochlear implant centers and schools, focusing on 140 children with bilateral congenital severe to profound sensorineural hearing loss implanted before 24 months of age. The researchers utilized the Social Vulnerability Index to assess socio-demographic status. Roughly 58% of patients were implanted early, meaning before 12 months, while 42% were implanted late, between 12 and 24 months. Standardized, age-normed language assessments at age 3 revealed that the early group had a significantly higher mean total language score of 94.0, compared to 73.4 in the late group. A sub-analysis of the early cohort showed that infants implanted before 9 months achieved a mean score of 100.2 compared to 88.5 for those implanted between 9 and 12 months. Although the Social Vulnerability Index was not associated with age at implantation, multivariable regression showed that both the index and age at implantation were independently associated with total language scores. This highlights that implanting infants as early as possible, ideally before 9 months, significantly improves spoken language outcomes. Staying with pediatric hearing, a population-based cohort study in JAMA, Otolaryngology head and neck surgery, investigated dried blood spot testing for identifying newborns with congenital cytomegalovirus. Cohort and colleagues analyzed 13,078 newborns from 26 birth hospitals in Utah, identifying 80 babies with congenital cytomegalovirus via expanded targeted screening. Testing neonatal dried blood spots for viral DNA using a polymerase chain reaction assay demonstrated an overall sensitivity of 86.3%, a specificity of 99.5%, and a positive predictive value of 100%. However, sensitivity varied significantly by clinical severity, reaching 92.7% for moderate to severe symptomatic disease, but dropping to 78.1% for mild cases. The authors caution against directly extrapolating these results to universal dried blood spot screening, particularly for asymptomatic infants. Moving to adult neurotology, an umbrella review in the laryngoscope by Chun and colleagues synthesized evidence from 22 systematic reviews with meta-analyses on Meniere's disease treatments. Intratympanic gentamicin demonstrated the highest vertigo control rate at 89%, though it carried a 23% rate of subjective hearing reduction. Intratympanic steroids offered more modest benefits with fewer auditory risks. Conservative treatments like oral betahistine and positive pressure therapy showed mixed results, while acupuncture showed symptomatic benefit only as an adjunct. For surgical options, endolymphatic sac decompression achieved 75 to 82% initial vertigo control, which declined over time. Cochlear implants improved speech and tinnitus in patients with profound hearing loss. The authors emphasize that treatment must be individualized and symptom-driven, as much of the supporting evidence remains low quality. Our next theme addresses pediatric airway safety and surgical risk profiles. A study in the laryngoscope by Diamond Pot and colleagues evaluated national trends in pediatric button battery exposures using the National Electronic Injury Surveillance System from 2020 to 2024. Despite public awareness and federal safety legislation, 24,891 pediatric button battery exposures presented to United States emergency departments. Annual cases rose by 70%, increasing from 3,785 in 2020 to 6,424 in 2024. When adjusted for the United States pediatric population, the rate increased from 5.1 to 8.8 per 100,000 children. Toddlers aged 13 to 24 months represented over half of all cases. While the proportion of cases requiring admission declined after peaking in 2021, the overall injury burden rose, with older and Black children more likely to be admitted, emphasizing the need for continued surveillance and prevention. Also in the laryngoscope, Sela and colleagues compared surgical risk profiles for pediatric sialorrhea. Analyzing 295 patients in the National Surgical Quality Improvement Program pediatric database from 2012 to 2023, the authors evaluated patients undergoing botulinum toxin injections, salivary duct ligation or rerouting, submandibular gland excision, or combined procedures. Compared to botulinum injections, salivary duct ligation or rerouting was associated with significantly lower odds of pulmonary complications, medical complications, and composite morbidity. Inpatient status and central nervous system abnormalities were independently associated with increased pulmonary complications. The authors note that the higher complication rate with botulinum injections likely reflects patient selection, as injections are often favored for medically fragile children, but these short-term risk profiles remain essential for counseling families. Our third theme highlights new developments in laryngology and rhinology. A retrospective study in otolaryngology head and neck surgery evaluated real-time light-guided vocal fold injection for unilateral vocal fold paralysis. Kim and colleagues analyzed 378 consecutive injections using hyaluronic acid in 257 patients via the cricothyroid approach. In all cases, the injection was successfully delivered at the intended target under light guidance, with no superficial injections or mucosal penetrations. The average procedure time was under 2 minutes, and no serious complications occurred. At 4 weeks, patients demonstrated significant improvements across all voice outcomes, including the Voice Handicap Index 10, the grade, roughness, breathiness, asthenia and strain scale, and maximum phonation time, establishing this as a highly precise and safe office-based technique. In another laryngological intervention, a prospective study in the laryngoscope investigated selective laryngeal cryotherapy as a sensory neurolytic treatment for refractory neurogenic chronic cough. Dhar and colleagues enrolled 30 patients who underwent awake selective laryngeal cryotherapy. The procedure was highly tolerable, with no serious adverse events and mild self-limiting side effects in 21% of patients. Post-procedure laser sensory testing showed a significant increase in the mean laser power threshold required to trigger a cough, rising from 2.8 watts to 7.5 watts at 1 month. By 6 months, patients demonstrated sustained clinical improvements, with significant reductions in both the cough severity index and the urge to cough visual analog scale, suggesting cryotherapy is a promising option to downregulate laryngeal hypersensitivity. In rhinology, a prospective study in the laryngoscope assessed the impact of psychological status on 5-year outcomes after endoscopic sinus surgery for chronic rhinosinusitis. Joe and colleagues tracked 1,069 patients using the Seno 22 survey, stratifying them into high and low psychological dysfunction groups based on baseline scores. 5-year data were available for 205 patients in the high dysfunction group and 196 in the low dysfunction group. At baseline, the high dysfunction group had significantly worse overall Seno 22 scores of 61.1 compared to 32.8. While both groups achieved similar relative improvements of roughly 45% at 5 years, the high dysfunction group maintained significantly worse absolute symptom severity. Multivariable regression revealed that preoperative psychological scores independently predicted worse postoperative non-psychological symptom scores, highlighting the need for preoperative screening to manage patient expectations. Our final theme focuses on clinical decision-making in head and neck oncology. A study in head and neck evaluated the impact of adjuvant radiotherapy in pathologically staged T2N0 oral squamous cell carcinoma. Nemeth and colleagues conducted a propensity score matched survival analysis of patients treated between 2015 and 2023. Among 400 eligible patients, 226 underwent surgery alone and 174 received adjuvant radiotherapy. Propensity matching generated 107 matched pairs, controlling for factors like depth of invasion, perineural invasion, and margin distance. The 3-year disease-free survival was 78.3% for surgery alone and 82.1% for surgery plus radiotherapy. This difference was not statistically significant, and adjuvant radiotherapy was not associated with improved survival, suggesting that routine adjuvant radiation may not benefit pathologically staged T2N0 oral cancer without other high-risk features. To aid in risk stratification, an international collaborative study in head and neck developed and validated normograms to predict recurrence after skull-base surgery for primary malignant tumors. Valero and colleagues analyzed 2,179 patients, splitting them into training and validation cohorts. The most common sites were the ethmoid, nasal cavity, and maxillary sinuses. Local recurrence was predicted by brain invasion, high-risk histology, advanced T-stage, positive nodal status, and positive margins, while adjuvant therapy was protective. Regional and distant recurrence predictors mirrored these findings. The resulting nomograms achieved a concordance index of approximately 0.7 across all endpoints, providing clinicians with a validated tool to personalize postoperative surveillance and adjuvant treatment decisions. If you only have time for one paper this week, make it the multi-institutional study on spoken language outcomes after early cochlear implantation. This study provides strong evidence that implanting congenitally deaf infants before 9 months of age significantly improves spoken language scores by age 3, setting a clear, actionable target for early intervention programs. Here are the key takeaways from this week in otolaryngology. First, cochlear implantation in congenitally deaf infants should be performed as early as possible, ideally before 9 months of age, to maximize spoken language development. Second, pediatric button battery exposures presenting to United States emergency departments have risen by 70% over 5 years, emphasizing the critical need for continued safety advocacy and rapid clinical intervention. Third, while endoscopic sinus surgery provides substantial 5-year quality of life improvements, patients with high baseline psychological dysfunction will continue to experience higher absolute symptom severity postoperatively, indicating that preoperative psychological screening is essential for counseling. Fourth, routine adjuvant radiotherapy does not improve 3-year disease-free survival in pathologically staged T2N0 oral squamous cell carcinoma, suggesting it should be reserved for cases with other specific high-risk features. Finally, selective laryngeal cryotherapy is a safe and effective office-based option that down-regulates laryngeal hypersensitivity and provides lasting relief for patients with refractory neurogenic chronic cough. That's your roundup for this week in otolaryngology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app, so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.